Hey everyone, so what exactly is blood pressure? When you have your blood pressure measured, the two numbers are telling you the pressure in your arteries when the heart contracts and when it is relaxed. In the walls of your arteries, there is smooth muscle. When your heart pumps blood out into the circulatory system, the arteries can expand and then they can squeeze back to normal when the heart relaxes. So the large number is the measurement of your blood pressure when the heart pumps blood out and the arteries are holding on for dear life as all the blood is flowing by. And this is called the systolic blood pressure. The smaller number, or the diastolic pressure, is when the heart is just kind of chilling there and the arteries squeeze back to normal, which also actually circulates blood. And a fun fact, in diastole, this is when your heart receives blood and oxygen, actually, not when it's actually pumping, but when it's actually relaxed. So if you think about it this way, it makes sense that when your heart is pumping, the systolic is actually the larger number because the pressure is higher, and the diastolic is going to be the smaller number. So blood pressure is pretty complex. We don't fully understand what causes certain people to have high blood pressure when there's no other cause. And there are many things that can affect your blood pressure. For example, when you get scared, your brain can tell your sympathetic nervous system to send signals to the heart to say, hey, speed up, we might need to get out of here. Or if your kidney is not getting enough blood, then it can release some hormones to tell the body to squeeze the arteries to increase the blood pressure. And while that's good in the short term, because maybe your blood pressure needs to be higher, it's not good in the long run. And if you remember the diabetes video where I talked briefly about regulating blood concentrations, when there's too much salt in the body from your diet or for whatever reason, certain sensitive individuals can retain water and the blood pressure can go up. So as we age, our poor arteries start to get a bit stiffer and they can't expand or squeeze back together like the good old days. So the blood pressure actually goes up. But doesn't pressure go up if the arteries expand, you might say? And it's actually quite the opposite. Think of blowing up a balloon. Remember how hard it is at the beginning, but then it gets easier as the balloon expands? So the same thing is happening in the arteries. If they can't expand well because they're stiff, then the heart has to push harder to squeeze the same amount of blood in the arteries and the pressure goes up. So with stiff arteries, the systolic blood pressure is high. But when the heart relaxes, since the arteries can't squeeze back as well as they used to, the diastolic is not high. So it's no surprise that the elderly have what is called isolated systolic hypertension. And that's just a fancy way of saying their systolic blood pressure is high, while the diastolic is not. So why do doctors get so upset if you're not managing your blood pressure well? Well, think back to the balloon example. What were to happen if you kept blowing up the balloon unchecked? So the arteries can fight this. They get thicker, and your heart can also get thicker of having to push against those pressures all day. But that's not normal, and you actually don't want that. It leads to problems down the road. And it's also worse where the smallest vessels are. Some of your organs can actually suffer a lot of consequences from high blood pressure, like the brain, the eyes, the kidney, or your gut. The walls inside the arteries actually can suffer damage too, and inflammation, and that lets cholesterol build up easier. And the problem is that you might not have any symptoms at all until the damage is already done. So remember to keep an eye on your blood pressure and see your doctor if your blood pressure is elevated, especially over 130, over 80 diastolic. Thanks for tuning in and see you later.